Okay, hello everybody. I decided to get up. I still have my robe on. I don't look cute. That's not the purpose of this video. I just didn't even have time to do any of that because I don't care. I literally woke up a little while ago. The first thing I did was check my Facebook and saw that one of my infectious disease physician friends has been putting a call to action all week. And this morning he had a disheartening video of him reporting at his hospital, and they're out of protective gear. We've heard about this for weeks. I don't know why people, the general masses, are having a mass hysteria and hoarding things like N95 masks and other protective gear that are a part of the equipment needed for physicians and other healthcare providers, especially in hospitals and the ERs, to be able to do their job effectively. So I'm a public health practitioner. I have worked in academic medicine for 11 years now, working for the infectious disease division at a university, as well as for the Department of Internal Medicine at a university. And all of our doctors are the doctors who not only train future doctors of America, but they're the ones that rotate through numerous hospitals throughout the county, as well as run our county health departments in 3 of the counties where I live. So I say that to say that I'm qualified to kind of explain this information to you guys. Now, let me break it down right quick, okay? So if you are wondering whether or not you need to have protective gear or how COVID-19 is going to affect you, for the majority of people, you're not going to get that sick if you get COVID-19, okay? If you have a pre-existing condition, however, if you have asthma, if you already have a respiratory disease like bronchitis or some lung disease, if you have heart disease, if you're 60 and up, because if you're 60 and up, the thought is that you are more likely to be immunocompromised, or you're more likely to have already an existing condition, then if you get COVID-19, it can be lethal to you, and or it can be more difficult for you to overcome. This is similar to getting a severe flu. It is cold and flu season. We've had more than 19 million people in the United States alone get the flu this flu season, and more than 16,000 people die from the flu. That includes more than 100 kids die from the flu this year. So at every flu season, it is always, if you are one of these people and you get the flu, then it is more lethal to you. So COVID-19 is a virus kind of similar to the flu, so it's the same thing rocks for you guys. For the rest of us, myself included, if you don't have a pre-existing condition, if you don't have any of these things here, then if you get COVID-19, it's not more severe than having a cold or the flu. I was sick as a dog at the end of January for 2 weeks. I was negative for the flu, negative for strep, negative for mono. It affected my throat. I probably had COVID-19, but guess what? There wasn't a mass hysteria yet in the United States about COVID-19, so there was no test available for me to get it. So more than likely, I already had COVID-19, and I stayed home for a week and a half from work. I had different symptoms every day until my body fought it off, okay? There is no special magic pill for viruses like the flu or COVID-19. You just have to work the course, which can take up to 2 weeks. That is why they're saying stay home for 2 weeks. So if this is not you, and you think that you might get sick and you think you have a fever, you don't need to go anywhere and get tested. Again, if you don't have one of these conditions, stay home. Stay home, self-quarantine until you recover. And then, of course, it's for 2 weeks. Now, why is it important to not hoard this protective gear? So we have little things called hospitals with ERs, right? And so this is where people are going, and they have no choice. They're going if they're having a baby, or if they're having complications delivering their baby and they've decided to stay home and do a home birth. You have people who have heart attacks, strokes, and other serious surgeries that are needed. We still have people who are breaking their limbs. We still have people who have true medical emergencies that have to go to the ER to get treated. We still have people who are getting their cancer treatment, and they have to go to the hospital to get that done, particularly to cancer hospitals. And we still have people who are getting pneumonia and even other viruses and other infectious diseases that the only way that they can be treated is if they physically go to a hospital and get treated by a healthcare provider or a physician. So we have a horribly drawn doctor here, but he has something important on, which is called a face mask. They also wear gloves. This is because they have to protect themselves as much as possible when they're interfacing with these patient types, okay? If you have if you're suspected of having COVID-19 or the flu or anything else, they still have to take a swab and they have to come close to your face and use their hand to put the swab in your mouth and go deep in the back of your throat to get a culture. I suck at that. Every time that when I was sick in January, whether I was in the ER or I was at the emergent care or I went to the regular doctor's office, every time they tried to put something in the back of my throat, I coughed my butt off. You're coughing and projecting stuff into their faces. They need to have a face mask on so that they can protect themselves. Well, this face mask is not covering his nose, so let's correct that. Face masks cover your mouth and nose. So let's just, all right, he's got a good face mask on now. Okay, so they need to wear their face masks so that way it reduces their risk of getting sick. Why is that important? Number one, if this doctor gets sick or gets COVID-19, then they're going to spread it to these people up here who are already super sick or immunocompromised. If these people get it, again, remember over here, they fall into this category. So if these people get it because their doctor got it, because the doctor didn't have the proper gear to wear, then it can complicate their recovery of their existing issue, or it can even lead to death for these people. All right? The second issue is that if the doctor gets it or the nurse gets it, then they have to stay home and self-quarantine. So what we're doing where I work is that we're trying to train a lot of our healthcare providers. We're trying to get them webcams so that they can do telemedicine. That's great, but that doesn't work for an emergency room, okay? Not every emergency room has a robot that they can remote into who can go along and do the care that they need. So if these doctors and nurses have to stay home, then who's gonna be doing the surgeries and treating all of these patients here in the ER? A less amount of doctors and nurses, which means we now have a provider shortage. So you have a less amount of doctors and nurses who can be in the hospital, which then means that, one, you're gonna have a burnout from all of the other nurses and doctors who have to pick up the slack because their colleagues are not working. So now you have a limited amount of people who can be in the hospital working. That's gonna lead to them being exhausted, which leads to medical errors, as well as them running themselves ragged, which means that they're higher susceptibility to get sick. And if they get sick, then they could spread it to their patients, which then complicates their patients' recoveries or even lead to death. Or they're gonna have to stay home themselves and self-quarantine, which leads to even more shortage of providers. Okay, so you guys are seeing how this cycle works. If you are hoarding protective gear, particularly masks, you are being grossly irresponsible and you are directly contributing to high rates of deaths and complications of other people, as well as to the mass scale number of physicians and nurses who are going to get sick because they don't have their protective gear that they need to go into work and do the job that they need to do. All right, I've worked with doctors, I worked with medical students, all of which who, when we had the Ebola scare, have volunteered and gone to other places to help out with Ebola scare and dengue and Zika virus, and they've always had protective gear. So you guys are sitting here telling me that for COVID-19 you don't want your physicians to have the protective gear that they need to do their job? Come on, stop it. If you feel like you're sick, stay home and self-quarantine. You have other people in your household, potentially who have asthma and these other things, and you don't, try to stay away from them, because if they get it, it's gonna be lethal and they're gonna have to go to the hospital. If you have loved ones who are in the hospital and you're trying to visit them, if you don't need to be there, then don't. It sucks, it's unfortunate. I have a lot of friends who have family who have been in the hospital with surgeries and pneumonia for weeks and kidney dialysis and all other things. Unfortunately, during this time, everybody won't be able to go visit them, okay? So just stay home if you're sick. Stay home for 2 weeks. Try to limit exposure as much as possible and stop hoarding protective gear and give those to those who need it, which are the healthcare providers.